We continue our lecture with type 2 hypersensitivity reactions. We call it cytotoxic hypersensitivity reactions, and we call it cytotoxic because in this case, immune system makes antibodies against own cells. We're going to talk about three types of disorders that belong to this group. We'll talk about autoimmune disorders. We'll talk about transfusion reaction as an example of cytotoxic hypersensitivity. And also we're going to stop on the hemolytic disease of the newborns, or we call it RH, disease of newborns. Alright, let's look at the top 4 pictures on this slide, because those pictures actually show how our immune system is supposed to work every time when we meet a pathogen in our life. So this is some kind of bacterium. Those are surface antigens on the surface of that bacterium. The next picture you see, those are immunoglobulins or antigens, those are actually antibodies that are produced already against those surface antigens. When antibodies are produced, remember, they attach to the antigens on the surface of the pathogen and form antigen-antibody complexes. But remember, every time when antigen-antibody complexes are formed, that will activate our complement system. And one of the parts of the complement system will be membrane attack complexes. This is what they show you on the next picture of this slide. So when membrane attack complexes get activated, they make holes within the cell membrane of that pathogen, and this way they destroy pathogens. Now, let's look at those bottom 4 pictures on the same slide. They show you what is going to happen if we transfuse wrong type of blood to our patients. You have to remember that our cells also have surface antigens on the surface of the cells, and those are actually will be recognized by immune system of that patient as foreign antigens. And again, once again, antibodies will be produced. They will attach to those antigens, form antigen-antibody complexes. It will activate complement system, and that cell will be destroyed. So that is an example of one of consequences of cytotoxic hypersensitivity reaction. What other consequences might happen? This reaction can cause activation of phagocytosis. It can cause clumping of the cells. And also, cytotoxic reactions can alter or change function of certain cells. Let's look at this. Autoimmune disorders. We're going to talk about 2 of them, Graves' disease and Goodpasture's syndrome. Let's start with the Graves' disease. In this case, for some reason, antibodies are produced to thyroid cells of the patient. What's going to happen next? Those cells will be activated. So those antibodies will stimulate cells to produce more of thyroid hormone. As a result, patients will develop symptoms of hyperthyroidism. What are those symptoms? The metabolism of those patients will be increased. It means they will have a good appetite but still lose a lot of weight. They will have complaints for tachycardia, anxiety, insomnia, dryness of the skin, mucous membranes, hair. They will have sleep disorders. And one of the specific symptoms that you will see when you look at those patients will be protruding eyes. Now, Goodpasture's syndrome, another example of autoimmune disorder. In this case, antibodies are produced against kidney cells. As a result, complement system will be activated, and in a lot of inflammatory mediators will be released. As a result, patients will develop chronic inflammation. Inflammation will be so severe it can cause kidney failure, and of course the only way for us to fix that problem will be dialysis or kidney transplant. Another example of type 2 hypersensitivity reaction will be a transfusion reaction. Uh, Before we start talking about transfusion reaction and symptoms of transfusion reaction, let's talk about 4 types of blood that we know. So if person has type A blood, it means that person has type A antigens on the surface of the red blood cells and makes anti-B antibodies in the serum. Person has type B blood, that means that person has type B antigens on the surface of red blood cells and makes anti-A antibodies in the serum. Now, type AB means those people have 2 types of antigens on the surface of the red blood cells, type A and type B antigens, and make no antibodies in the serum, which means those patients we call universal recipient. Because they have no antibodies in the bloodstream, they can accept any type of blood. And finally, type O blood, it means those people have no antigens in the surface of red blood cells and make anti-A and anti-B antibodies. And if a person with type O has Rh negative type of blood, that means that person can be called universal donor. So what is going to happen if we transfuse wrong type of blood to our patient? Patient will develop symptoms of transfusion reaction. What are those? Blood in the urine, chills, fever, dizziness, fainting, back pain in the kidney areas, rash on the skin. The blood pressure of that person will go down, and then patient might get in a shock and a coma. So why those patients develop those symptoms of transfusion reaction? Because every time when we transfuse wrong type of blood to our patients, antigens on the surface of the red blood cells of that blood will be recognized by immune system of that patient as a foreign antigens. So antibodies will be produced, it will activate complement system, and red blood cells will be destroyed. And on this chart, again, you see the main characteristics of different blood types. And you see AB, and type O. We've already covered this chart. And the last example of cytotoxic hypersensitivity reaction will be hemolytic disease of newborns, or we call it Rh disease of newborns. Before we start talking about hemolytic disease of the newborns, let's talk about Rh factor. You probably know that most people are Rh positive. What does it mean? It means they have that additional type of antigen, we call it Rh antigen, on the surface of the red blood cells. And yes, most people are Rh positive because we have that antigen. But there's a percentage of population that has no Rh antigen on the surface of red blood cells, and we call those patients Rh negative patients. So when we have this problem, hemolytic disease of the newborns, we have this problem if Rh negative female gets pregnant with the second, third, fourth, and so on Rh positive child. Why not the first one? Let's look at this picture. When Rh negative female gets pregnant with the first Rh positive child, it's not going to cause any problems because fetus and the mother's blood are separated. And nothing is going to happen before the child will go through birth canal. But when that child will go through delivery, goes through the birth canal, then some blood of that child can get through umbilical cord, can get into the mother's system. Because the mother is Rh negative, it means those Rh antigens will be recognized as foreign antigens. It means immune system of that female will start producing anti-Rh antibodies. But they will not affect this newborn child because child is already born. But keep in mind, mother has already in her system anti-Rh antibodies. We usually start having problems when the same Rh negative woman gets pregnant with Rh positive child again. Remember, antibodies can cross placenta, and when they cross placenta, they can destroy blood of that fetus. As a result, the child will develop symptoms of hemolytic disease of newborn. What are those symptoms? Jaundice, elevated bilirubin levels, profound anemia. In difficult cases, those children can develop heart failure, enlarged spleen, liver. Usually symptoms of hemolytic newborn will be developed on the 6th day after delivery. How can we prevent this problem? Today, to prevent this problem, we use anti-Rh immunoglobulin. We call it ROGAM. So when we inject ROGAM to the mother's system, usually we do it several times during the pregnancy, before delivery. That will stop immune system of that woman from the production of anti-Rh antibodies.